Okay, hi everybody. As we getting started here on our webinar for the Washington Health Corps application. Sorry, I have two things going on here. So a little bit of housekeeping at first. If you're familiar to Zoom, there is a Q&A feature down at the bottom of your screen. So any questions that you want to ask for us while we're going throughout the presentation, feel free to put in there. We'll be answering questions along the way. There'll be a few break points after some of the sections to answer some of those, and then some that may not be relevant to that section we'll save to the end. If any of your answers require like some further deeper research, we'll get back to you. We'll just get your email address from you and get back to you after with a response. This webinar is recorded. You are, as a participant, are not seen on the recording, just us. And then it will be made available along with our slides on our website after this. So I'm just going to start with some introductions here. I'm Kristen. I am the program coordinator for the health program. And we have Jacqueline, our program manager, that will be doing the main part of the presentation. And then Melissa is our associate director. So I'm going to go ahead and pass it off to Melissa.
Hi, everyone. Thank you so much for joining us this early evening. We really appreciate your time. We have some great overview slides available for you, and we look forward to working with you throughout the application process. So I'm going to pass it over to Jacqueline, who's going to introduce herself and take it away.
Hi, everyone. My name is Jacqueline Cook. I'm the program manager for the Washington Health Corps. Okay, so today we're going to be going over the application process and timeline, the overview of the Washington Health Corps programs, provider eligibility, how to apply for this 2021 cycle. We're also going to share some resources with you. And at the end, like Kristen said, we should have plenty of time for questions. So first, we're going to start with the application process and timeline. The first step in the process is for a site representative to apply and request pre-approval status for their site. The site pre-approval application is open year-round, and we have a list posted on our website by provider type. If you don't see your site currently on that list, they can still apply during this time, during the provider application opening, but their application must be completed and approved by the close of the provider application for you to be eligible for this 2021 cycle. The next step in the process is for providers to apply during the application opening. To be eligible for consideration, providers must be working at a pre-approved site or have an employment contract to start work at that pre-approved site on or before July 1st. And the third step in the process, after we've received all of the submitted applications for providers, is for the site representative to certify the information within those applications and then provide additional details about their site for our scoring process. So what you're seeing on your screen is the 2021 provider application timeline. The application opened in January and it will close in March of 2021. We'll start site certification in April, and then we'll begin scoring and selection in May. And we hope to let awardees know if they've been awarded in June, so that they have time to sign their contracts before their service obligation would begin on July 1st. So I just wanted to share these dates again. For the 2021 provider application, it opened on January 5th, and it will close on March 1st. going to stop there to see if there were any questions that came up during those first slides.
Jacqueline, we do have one question, but I'm going to hold on that till we go a little bit further. So we'll come back to that one. So go ahead and keep going.
Okay, great. So right now we'll do an overview of the Washington Health Corps programs. The Washington Health Corps is an umbrella, and underneath it are 3 separate programs that we administer. The first program is the Federal Health Program, also known as FHP. The awards for this program are federal funds matched with state dollars. The maximum award is $70,000 for a minimum 2-year service obligation. And with this contract, you are required to work full-time, which would be 40 hours per week. The maximum amount of days that you're allowed to be away from your site each contract year, which would be July 1 through June 30, is 35.7 days. And for all 3 contracts that I'm going to be discussing, days away are holidays, sick leave, vacation, and continuing education. The default penalty for this contract is a bit strict. It's months not served times 7,500 per month plus interest. So it'd be a minimum of $31,000 for a payback if you were to default on your contract. The second program is called the State Health Program, SHP. These are awarded with state funds only. The maximum award is a $75,000 award for a minimum 3-year service obligation. You are allowed to work less than full-time with this contract, but you have to work a minimum of 24 hours per week. The maximum amount of days you're allowed away from your site each year are 40 days. And the default penalty is the amount equal to the unsatisfied portion of the service obligation or the total amount paid by the program on the participant's behalf, whichever is less. So for example, if you were awarded a $75,000 award and you served 1 year of your contract, you would receive $25,000 if you worked full-time. And if you defaulted on your contract at that point, you would owe back $25,000, as that is less than $50,000, which you have left in your service obligation. So the behavioral health program is our 3rd program. It was passed in legislation in 2019, and it's very similar to the state health program. Its awards are used with state funds only. It's a $75,000 maximum award with a minimum 3-year service obligation. Again, you can work less than full-time, but you have to work a minimum of 24 hours per week, and you're allowed 40 days away from your site each contract year. The default penalty is the same as the state health program, the amount equal to the unsatisfied portion of the service obligation or the total amount paid by the program on their behalf, whichever is less. So before I move on to provider eligibility, are there any questions about the overview of the Washington Health Corps programs?
Yes, we have a question. If a provider works overtime, are they still limited to the program time away?
Yes. So if you're flexing your time, you're allowed to work with your site. So if you're flexing your time and let's say you had a holiday or a sick day earlier in the week and you wanted to work on a Saturday, as long as your site's okay with that, we're fine with you making up those hours and not counting that day away. So yes, that is possible to do that.
Thank you. And there is a question here about award payments. So we can answer that now, or if you think it is better later in the presentation, we can do that as well. But the question is, are awards given up front? And I would expand on that to say, how are award dollars distributed to providers?
Sure. So the funds are not provided up front. They're provided quarterly. So if you're awarded, your site is supposed to send in your service hours each quarter, and your payments are based on that service amount of time that you've worked. So it is quarterly payments throughout the time of your service obligation.
Thank you. And can you clarify about currently what telehealth service work is allowed
I'm
under
actually
the required hours?
Sure. Yeah, I'm going to get to that in the next section, I believe.
Okay, great. And this also question relates to service verification about how often they report hours. So can you say again how often we collect our verification on service?
Yes. So it's a quarterly service verification form, which actually is on our website if you wanted to look at it. So you would fill out one portion of it with your information in the site that you're working at. You give that to your site for them to confirm your work, and they report their hours and submit the form to us. And that's required every quarter. The first quarter of the year is July 1 through September 30th, and so on. So it's October to December, January to March, and then April through June. And each time we receive that service verification form is when we process a payment to you.
Great, thank you. One additional question. Clarifying, you talked about how the federal program in particular has very strict guidelines about repayment if someone is unable to complete the contract. Can you say a little bit more about unexpected scenarios where someone could not complete a contract, where they would be excused from completing that contract?
Yes, because it's we have a federal grant, so it's federal guidelines. We're bound by that. So the only reason that you could possibly get out of a contract in the federal side is by having like a medical issue that you could no longer work. That I believe is the only reason that you would be able to possibly cancel your contract without a penalty.
Great, thank you. We have additional questions about the time away related to FML.
Okay.
If you're getting to that later in the presentation, we can wait for those, but can you describe a little bit more about how FML and time away, how that works?
Sure. So we also offer something called a deferment. If you're away from your site for medical leave, FMLA, anything related to that, we can offer a deferment, which essentially is a stall in your contract. So you would not be accruing days away, you would not be accruing service hours, but those days away would not count against you. So you would not be getting a payment for part of that quarter or the whole quarter if that was the case. And then your contract would, the hours that you're missing, your contract would extend at the end of it. So there is some wiggle room there, and the deferments are allowed for things like FMLA and medical leave. And you can defer for up to a year during the time of your contract.
Thank you. And when someone is applying, do they indicate which program they are interested in applying to? Or is that something that WASAC is responsible for placing someone according to their eligibility?
Yeah, that's a great question. There's one application for all three programs. So there are different eligibility standards for each one, and I'll get into that a little bit in the next portion. But essentially, if you're eligible for all programs, great. We put you kind of in a ranking order, and we award federal health program first. If you're not interested in that, say you think your schedule might change, or you just don't want to deal with the default penalty or anything like that, you can decline the federal health program award, and you would get moved into the state health program selection. but you can't decline from the state and then possibly be awarded anywhere else. So just want to point that out.
Okay, I think those are the questions we'll answer for this round. Go ahead and keep going, and we'll keep watching the Q&A, and we'll pause again to answer more questions. Thank you, Jacqueline.
Yes. Okay, so let's move on to the provider eligibility. So to be eligible as a provider, you have to be a permanent employee of a pre-approved eligible site or sites and seeing patients at the time of the contract start date, which is July 1st. You have to also maintain a current, full, permanent, unrestricted, and unencumbered health professions license in Washington State. And if you're duly licensed, you need to apply under the licensure for which the majority of the work is done. And you also need to be providing comprehensive primary care. Program rules require that participants be providing comprehensive primary care through primary medical care, behavioral and mental health services, and/or dental services. Comprehensive primary care should provide care for the whole person on an ongoing basis and not be focused or limited to gender, age, organ system, a particular illness, or a categorical population. We have a more elaborate description of comprehensive primary care in our reference guide, but I just wanted to share that piece of that with you. So along with providing comprehensive primary care, there is a minimum hour requirement for direct patient care. So for all professions except for OBGYNs, geriatric, and pediatric dentists, the minimum percentage of direct patient care hours per week should be 80% of your hours. The maximum percentage of other hours per week should be 20%. And other hours may include providing direct patient care in alternative locations as directed by the pre-approved site or performing practice-related administrative duties. If you are in the OBGYN or geriatric or pediatric dentist professions, you're required to spend 52% of your minimum hours a week with direct patient care, and 48% can be spent in other hours. However, you cannot exceed the 20% in administrative time each week. So in normal circumstances, those are our requirements. However, due to COVID-19 and the state of emergency proclamation by the governor of Washington State, participants' hours, employment status, and care offered may change. We have a full FAQs listed on our website if you'd like to take a look at that. But at the direction of your site, you may do the following through the duration of the COVID-19 emergency. Shift your regular clinical service to patients to be delivered via telehealth, telemedicine. Our current requirements are 25% telehealth, so this allows you to do 100% of your hours through telehealth if you're directed by your site to do so. You can also shift your regular clinical service to changes in types of service, such as an increase or decrease in administrative duties. You can receive service credit for clinical care to patients impacted by COVID-19 at temporary locations. And you can also receive credit for working temporarily at another site. And like I mentioned before, we are offering deferments like we normally do in case someone is laid off or has furlough days, so that those days that as a result of COVID-19 don't count against you and you could possibly default in your contract. So to be eligible as a provider, you also must not have an outstanding contractual service obligation unless that obligation will be completely satisfied before July 1, when your contract with us could potentially start. A service obligation could be the federal government, so the National Health Service Corps, possibly another state loan repayment program, or sometimes an employment contract will have a service obligation tied to it for such things as a sign-on bonus or a recruitment bonus. So now I'll move on to the eligible disciplines for each program. For the federal health program, you'll see physicians, allopathic and osteopathic, physician assistant, nurse practitioner, certified nurse midwife, registered nurse, pharmacist, dentist, which includes DDS and DMDs, registered dental hygienist, licensed independent clinical social worker, licensed clinical psychologist, licensed marriage and family therapist, and licensed mental health counselors. And I just want to note that the last four that I mentioned for all programs for FHP, SHP, and BHP, individuals with an associate level restricted credential are not eligible. They require a full independent license. So for the state health program, you'll see the same profession types listed with the addition of naturopathic doctors, licensed midwives, licensed practical nurses, and chiropractors. And for the behavioral health program, the eligible disciplines are a licensed independent clinical social worker, a licensed clinical psychologist, a licensed marriage and family therapist, and licensed mental health counselor. So I'll pause there before we move on to how to apply.
Thanks, Jacqueline. We have a few questions about the 80% guideline that you talked about, the requirement. So I think it'd be helpful to go back to that slide, and then I'll read you the two questions we have related to that.
Sure.
So the first question is, in regards to the percentages spent seeing patients, is it 80% of all hours worked, even if the hours worked are higher than what is required in the program?
No, it would be 80% of the hours that are required. So if you were in the federal program, it would be the 40 hours a week. And then if you're in the other programs, a state health program or the behavioral health program, it would be 80% of the hours that you work. So essentially you wouldn't be, if you worked part-time, it would be those 24 hours a week. But if you worked in between part-time and full-time, it would just be based on those hours that you're working.
Thank you. The other question we had about the 80% is asking, does the direct service requirements mean that we have to be available for 80% of the day for patient contact, or we have to have 80% direct service productivity?
Yeah, it is 80% of, so the second, can you read that again? Sorry, I think it was the second way that you said that.
Does the direct service requirement mean that we have to be available for 80% of the day for patient contact, or we have to have 80% direct service productivity? So I think they're saying availability versus what they actually did or served.
Yeah, it would be what you did or served.
Great, thank you. We have a question about switching clinics during service. Can you talk about what our process is for that?
Yeah, so it is possible to make a site change If you let us know in advance, that's always great. But they do, if you're changing sites, you do have to make sure that they're on our pre-approval list. First, if they're not, it is possible for them to apply. Like I mentioned before, the site pre-approval application is open year round. So it's possible for you to find a position at a site that's not currently on our list, and we could add them if they're eligible. And then there's just a little bit of paperwork involved to change your site mid-service obligation.
Great, thank you. And we have a question about the COVID exceptions in relation to our policy changes. The question is about extending through 2021. And I think I can answer that by saying that at this time, we are unsure of how long we will be extending those. But if we do, we would be notifying all participants as well as posting that to our website. And then we have a question about eligibility. So if someone has a pending license and they would be applying in this pending status with their license, and it will become active before July, are they eligible to apply?
Yes, that's a great question. I was going to mention that in a little bit, but yes, because I know with COVID, there are some delays with DOH. So if you think that you will be licensed by July 1, you're welcome to apply. And once you become fully licensed, if you could send us an email, that would be great, because then we could double check it on the DOH website. But yes, you are eligible to apply if you think you'll be licensed by July 1.
Great, thank you. And I think the last topic to talk about in this section is if you can say a little bit more about where we define direct patient care and the guidelines there. So for example, one of the questions we have on that is direct patient care. Does that include treatment, team discussions, and similar activities that do not involve face-to-face contact with the patient? For example, working at a state psychiatric hospital.
Sure. So we define direct patient care as the direct delivery of healthcare services to a patient. Direct patient hours must occur during normally scheduled clinic hours at a pre-approved site. For full-time participants, teaching activity hours can be included if the clinical education is conducted as part of an accredited clinical training program, or includes the clinical supervision of a student/resident that is required in order for that student resident to receive a license under state law. And that's the definition from our reference guide.
Great, thank you. I think those are the questions we'll answer for now, and go ahead and keep going.
Okay. Okay, so if you are an eligible provider, our provider application, like I said before, is currently open. The link to the online application is available on our website. The application is open from January 5th to March 1st. And applications must be completed and submitted by 5 p.m. on March 1st to be eligible. We require a current loan statement to be attached to the application. So it should be your most current lender statement, should show your lender name, your name as the provider, your account balance, and the date of the statement. It should include all eligible debt. Additional debt cannot be added after the application is submitted. So eligible loan debt for the Washington Health Corps programs is U.S. federal government and commercial loans that were for actual costs paid for tuition and reasonable educational and living expenses related to the education required for this licensure the provider is applying under. So loans related to obtaining the licensure for that profession only. For federal loans, we recommend going to the studentaid.gov website. If you access their website, you can create an account, or if you already have an account, you can log in. And it will take you to the federal student aid dashboard, which will show all of the loans that you've taken out, all federal loans, I'm sorry, that you've taken out. If you click on view details, which is highlighted in yellow, and then go to download my aid data, which is also highlighted in yellow, it will take you to a synopsis of your federal loans that you have. And that's just a great place to gather all of that information at once so that you can just send us one statement. So ineligible loan debt for our programs would be loans for which the provider incurred a service obligation that will not be satisfied prior to the start of the contract, such as the National Health Service Corps. Primary care loans, loans that have been consolidated with personal debt, parent plus loans, loans that have no current balance, credit card debt, or personal lines of credit. And Washington Student Achievement Council will not pay for otherwise ineligible loans that have been consolidated with eligible loans. So we wanted to bring some common application mistakes to you, just so it might be easier for you to submit your application. If you have more than one loan with your servicer, only list the total balance with that servicer. For example, sometimes within a statement, it will show all the types of loans that you've taken out, like a direct grad or a direct unsub, those types of loans. We don't need to have that specific on this page for the application. We just need to see the servicer and the balance. But if you have multiple lenders, we want to see those all listed out. This is just referring to if you have one servicer with the individual loans listed out. So if your loans have been consolidated, we need to see the original loans to verify eligibility of each loan. This may mean that you have to reach out to your servicer to receive a different type of statement. If the name on your application is different from your loan documents or license with the Department of Health, please email us to let us know after you submit your application. If you didn't do that or you haven't done that, that's fine. We'll reach out to you, but we need to know the difference for the name change. If you work at more than one site, please list the main site as the first location in the application, and then list the other site locations after. And then again, you must be working at a pre-approved site or have an employment contract to start work at a pre-approved site on or before July 1st. So we wanted to share with you the criteria for our selection and scoring. Selection is based on criteria outlined in our Washington Administrative Code, which you can access online. Funding priorities and shortage needs identified by the Washington Health Corps Planning Committee. Our planning committee meets twice a year and consists of members from the Department of Health, DSHS, members from healthcare facilities, provider groups, OSPI, and other public and private agencies. Selection could also be based on site criteria, which may include but are not limited to geographic location, ratio of underserved patients, staffing characteristics, and the use of a sliding fee schedule. Could also be based on provider criteria, which may include but are not limited to background, experience, and patients served. Selection could also be changed based on legislative directives, and we do take consideration of the distribution of awards across sites and professions. So I'll pause here if there's more questions.
We have a question related to loans that someone got on their way to another part or higher level of their licensure. So the question is, I have loans as an RN and an NP. Do these count as different professions, or can I submit them all as one? So in other words, the loans that I got along the way to becoming a nurse practitioner, may I count those?
Yes, because I believe you have to be an RN before you can be an NP. But yes, if the loans were what gave you stepping stones to what your profession is now, then they could be included.
Thank you. And to expand on that further, for example, if you have a bachelor's degree in something that's maybe unrelated to what you ultimately went back to school to become a dentist or a nurse practitioner, you had to have that bachelor's degree to get to that ultimate graduate degree. So those would be eligible as well. So we have an additional question here about oh, sorry, just want to make sure I'm getting to the right question at the right time. Can you go back to talk about what happens if, due to patient no-shows, you do not meet the 80% direct care requirement?
Yeah, we get this question a lot, I think more in the behavioral health professions. And if you can spend your time, like, for example, if you had a no-show, but you were able to then fit in some admin time, or if you're able to pick up another client. Unfortunately, the way that the rules are written in our programs, it does impact that kind of wait time if you have a no-show. So if you're able to kind of fill in your time with other things, then we would be able to count that as service hours. If you're awarded in the state health program or the behavioral health program, you could also just report lower hours. That's what we see sometimes. So some weeks you might have a little bit less hours that you can report based on those no-shows.
Okay, thank you. I think we're going to save these last questions for the end. So go ahead and talk about the resources.
Okay, sure. So a great resource is our Washington Health Corps website, where we have a link to the application, both the provider and the site pre-approval application. We have our reference guide, which must be reviewed prior to submitting your application. We have our site pre-approval list. We also have a place to subscribe to email updates and our contact information for questions or anything that might come up during the application process or if you are awarded. Also wanted to provide a few resources for other types of loan repayment. The National Health Service Corps with the Health Resources and Services Administration, also known as HRSA, is a great place to look for another loan repayment possibility with the federal government. Some participants apply at the same time. You can't do the service obligations concurrently, but some apply after they've already served their Washington Health Corps and completed their contract with us, or vice versa. So that's a great resource to review if you're looking for another type of loan repayment program. There is also the Public Service Loan Forgiveness Program. So if you are employed by a U.S., federal, state, local, or tribal government, or a not-for-profit organization, you may be eligible for the Public Service Loan Forgiveness Program. And this, you can accrue your service hours and your service years while you're serving in the Washington Health Corps if you are awarded. So is now the time to ask more questions if you have them.
Great. Thank you, Jacqueline. So we have a couple of questions that relate to someone being self-employed or an independent contractor. So can you talk about, maybe give a high level again about how sites get approved, and specifically about people who are self-employed or working as independent contractors?
Yes. So in order to be eligible for our loan repayment program, you have to be an employee at a pre-approved site. The first step is for a site representative to apply for the program to be on the site pre-approval list, and then you would be eligible as an employee of that site to apply for the provider loan repayment program. At this time, contracted workers are not eligible, as you have to be a full employee at a site to be eligible.
Thank you. And can you talk again about the site approval application and approval timeline? So for example, when do sites need to apply, and can a site apply in the same cycle as the provider? Those are the main questions.
Yeah, so the site pre-approval application is open year-round. To be eligible for the program for this cycle, your site, if they're not currently on the list, would have to apply and be approved by March 1. So before you could submit your application, your site would need to be approved. And I would recommend doing that the sooner the better, so that you're not running up into that deadline of March 1. But if they apply in the next month, we possibly could have them approved in our system for you to then submit your provider application.
Thank you. And this webinar is really focused on providers and their application. And we had a question, are we going to review the site application process today? And I can answer that to say, no, we will not be reviewing that process in detail. And if someone does have questions, we are happy to help them. And the best way to reach us is via our email address, which will show on the screen here in just a minute. Okay, we have another question about eligibility for the program in terms of number of times you can apply. And then if you do receive it after your contract expires, can you apply again? So can you talk about that?
Sure. Yeah. So there's no limitation to how many times you can apply for the program. We recommend applying every year if you're interested, because like I pointed out in the selection and scoring, our priorities and funding priorities can shift from year to year. So one year you might not have been awarded, but we really encourage you to apply in the next year, because it's possible that you would be awarded then. If you are awarded and you've completed your service obligation, you cannot reapply. The National Health Service Corps allows you to apply for extensions, but our program does not. So I think sometimes people get them a little bit confused. We do, depending on funding, sometimes are able to offer extensions. They're 1-year extensions But because of our lack of funding, we prefer to use that for new awardees and new participants, as opposed to giving current participants extensions.
Thank you. And can we just, obviously before the resources, we talked about loans and how we make payments. Can you talk a little bit more about who we pay the money to? So does it go to the provider? Does it go directly to the loan provider? And additionally, is there any impact on interest, or how does interest continue to accrue or not while the loans while a provider is part of the program?
Yeah, that's a great question. So we do pay the provider directly. You're required to sign up for a statewide payee number through the Office of Financial Management, which is another state agency, and that's how we would process payments to you. And then you're required to take those payments and apply them to your loans. We do ask for loan documentation once a year to show that the money that we've given you is applied to your loans. And then can you repeat the second part of that question?
Yes, it has to do with interest accruing while they're in the program. So can you just talk about what happens with interest to their loans while they're in the program?
Sure. Yeah. So interest continues to accrue, and our awards are, either 70,000, 75,000, or the amount of your eligible debt at the time of the application. So interest is not put into your award amount, unfortunately. So that is something to think about. You probably, if you're awarded your actual loan debt amount, you might still have some loan debt out there if you're just applying the payments that we give you.
Thank you. And we have another question about, again, this idea of direct care hours and what counts. Can you talk about travel to and from clients? If someone has to travel to a client, does that count for direct patient care?
Unfortunately, travel time does not count towards direct patient care.
Great, thank you. And there's a question overall about how many awards that we give per year. Can you provide some, just a big picture of where the budget comes from for this and how that dictates how many awards we give out?
Yeah, sure. So we are allotted a certain amount by the legislature by biennium. So we receive funding for our state health program, our behavioral health program, and then a match to the federal dollars that we have for our federal health program. And so based on that funding, we're always trying to award as many people as possible, but it does kind of depend on if most of the applicants are getting a full award or they're getting their loan debt, which could be less than the 70 or 75,000. So last year we had approximately 400 applications, and we were able to award about 100 of them.
Great, thank you. And can you say a little bit more about, actually, before I get to that next question, we just had one come in that I'm going to answer. So we have a question about if the pandemic budget shortfall has reduced the budget for 2021. So currently, we're awarded funds from the legislature on a biennium basis. So that's on a 2-year basis. So the funds that we would be awarding for this year are funds that we already have secured in the bank, if you will, that we commit to this year and then pay out in following years. So awards this year would not be impacted. It could potentially impact future awards if there was to be a budget cut. But our initial look at proposed budgets that we've seen from the governor's office do not indicate that this program would get cut. However, of course, that could change. at any point in time based on what the legislature does. So, okay, and then we have an additional question about if you can go back and talk again about when someone has to end their contract early. Can you say again what happens with the federal program, and then can you differentiate that from the state and behavioral programs in terms of what somebody owes back if they have to end early?
Yeah, sure. Let me pull that up one moment. So for the state health program and the behavioral health program, if you were to breach your contract or breach your obligation, you would owe the state an amount equal to the unsatisfied portion of the service obligation or the total amount paid on your behalf, whichever is less. So essentially, if you have completed the majority of your contract and let's say you had $10,000 left in your service obligation, you would only owe us back the $10,000 that's left there because it's less than what we have paid out to you. So there's sort of a tipping point at the beginning of your service obligation. You would owe whatever we've paid out to you, and then at a certain point that would balance out, and then you would owe what your remaining service obligation is. And for the federal health program, like I said before, it's a bit stricter. So it's the amount equal to the number of months of obligated service not completed multiplied by $7,500, except we're supposed to recover not less than $31,000. So the minimum default penalty would be $31,000 for the federal health program.
Thank you. And we have another question related to, again, that idea of direct patient care. So if someone is required to provide training to other people, other healthcare providers, potentially in addition to some of their, or as part of their work as a healthcare provider, would those training hours that they're providing, would those count as direct patient care?
They would, if it's conducted as a part of an accredited clinical training program, or if it includes the clinical supervision of a student or resident that is required in order for that student or resident to receive a license under state law.
Thank you. And if that's in the reference guide, can you clarify what section they might find that information in if you have that up?
Yeah, so that's on the 12th page of the reference guide under program service requirements.
Great, thank you. And a follow-up question to this idea or the requirement, excuse me, of owing money back. The question is, do they actually pay the money back of what has been paid, or do they just not receive that remaining part of the award? So can you clarify what actually has to be paid back to WASAC in terms of dollars there, and then any kind of broad definition of interest and fees on that?
Yeah, that's a good question. So you are required to pay that back. Essentially, in my example earlier, if you served 2.5 years of your contract and you had $10,000 still that you could potentially earn because you didn't complete those hours, you would owe us that $10,000 plus interest and fees. So it is something that we couldn't just wipe out. You are required to pay that back to us.
Thank you, Jacqueline. And I think to add to that, the idea is that when you are awarded the dollars, you're agreeing to serve at an eligible location for the amount of time in the contract. And so if you are unable to serve those hours, you either owe the served hours back, or you owe the money back that would have been equivalent to those hours that you were no longer going to serve. Okay, we have an additional question. about someone who might decline the federal program. Would they automatically be in the state program? Or is it possible that if they decline the federal, they would lose out on any program acceptance at all?
Yeah, so I guess the answer is I can't say 100% that you would be put into the state program, but the way our program is structured, we award federal first. And so if you took yourself out of that pool, then you would enter into the state pool, and you would most likely be offered an award at that point. I've never seen someone be or decline their federal award and not receive a state award, but I guess it's not 100% that would be the case.
Thank you. And we had a question that we responded to via the typing feature, but I think if you could direct people to, if they have a question about their specific licensure and whether or not they qualify, for example, as a mental health counselor with their licensure, where can they go in our materials to find that information?
So we have a list of the eligible disciplines and specialties in our reference guide. We also have a table on our website that would list those out. And if you are unsure if you have a full license with those mental health profession types, you could also look on the DOH website. They have a license check there for the requirement.
Great, thank you. So at this time, we have no other open questions. So Jacqueline, if you would like to end the webinar for us by concluding, that'd be great.
Sure. So thank you for attending. If you have any additional questions during the application process or something that you didn't get answered today, please reach out to us. Our email is health@wasac.wa.gov, and you can also go on our website and find our email, sign up for email updates, and our customer service line if you have any additional questions.
Great, and I will add to that as we mentioned in the beginning, we are recording this session, and we are going to make the recording and the slides available on our website. So watch for those. And we, again, so much appreciate your time. And if you have additional questions that we haven't discussed here, please email us and we will get back to you as soon as possible.